Hi, hello. My name is Filipe Costa and I'm a dentist here at Monteiro Dental Clinic. Today I want to talk to you about bruxism. You probably heard this term before. It's a medical term for something that is most well known as teeth grinding. It's something that happens quite frequently. It can happen during the day or during the night and is characterized by a clenching or a, a grinding of the tooth, of the teeth one on another, top and bottom for example, and it happens to an extent that it can cause other serious problems. It's called the parafunction because it is a function. The teeth are doing what they're supposed to do, which is to bite into each other, but they're doing it in a way that is abnormal. In other words, we're doing it too much. The symptoms of bruxism are several and they're very varied, but the most important ones will be pain, the wear of the teeth, and what these things cause, which will be a poorly sleep at night, which will then impact on your day-to-day life. The pain will come from the clenching of the teeth and the tension of the muscles throughout 8 hours, 6 hours, whatever the night time is. But the muscles on the face will clench constantly. The chewing muscles, which are not just on the face, they'll be on the head, they'll be on the upper back. So all these areas will be quite tender after a session of clenching, which could last quite a few hours. Patients that will wake up in the morning feeling headaches, probably they are grinding the teeth at night. The wear on the teeth is also very, very obvious, and your dentist will spot this very quickly, and it has to do with the clenching and the wear of the teeth one on another. It can in some cases be so severe that the outer layer of the tooth just pretty much disappears and the inner core becomes exposed, so sensitivity to hot and cold temperatures will be quite intense. Of course, these things will reflect as a poor sleep night, so not enough rest, which will then impact on anything, your general health, your productivity at work, everything really in your life. The causes for bruxism are not very varied, but they can range from something very, very complex to something quite simple. The most common one is stress. Okay, everyone in this day and age, from kids to grown-ups, we all suffer some sort of stress. It can happen in periods. For example, a wedding preparation, moving houses, having babies. I know so many episodes in life that could cause that stress. It could be something a bit more long-term, like being unhappy at work and things like that. But it's something that we can't really change because it's life, but that will impact on teeth, so we have to think about that in that perspective. Other things will include, for example, medication. There are some medications that you get from your GP that will be a chronic, like a repeated prescription medication that could affect in somehow the sleepless nights and the grinding of the teeth will come with it. So if that's something that your dentist can't spot, it might be an idea to speak to your GP, because the reason that the cause might be there. Of course, all the drugs, what we call recreational drugs, alcohol, tobacco, all these other things that we could do, could of course affect it in some way as well. The treatment for bruxism is of course depending on what the cause of it is. There are very, very complex treatments that will involve surgery and things like that, but mostly, and the vast majority, can be managed and in some cases treated with a simple night guard. The fabrication of the night guard is pretty straightforward. It's painless, it's quite quick to do as well, but the results that you'll get from it are massive, are immense. Straight away, almost immediately within a few days of wearing it, headaches will disappear, backaches will disappear. The wear of the teeth will be of course a lot less. It won't bring the tooth back because unfortunately enamel doesn't regrow, but it will stop the wear where it is. So whatever was happening at that point, it will stop there. Eventually, if the grinding continues for the first few months, let's say, until it stops completely, at least you'll be wearing on grinding on the night guard and not so much on your teeth. Of course, we can replace night guards. It's a bit harder to replace teeth. But that is an example of something that, if it's appropriate to your case, it's something that you can very quickly get fabricated and very quickly start to feel the benefits from wearing it. And of course, at the clinic, we'll be more than happy to welcome you and analyze it, discuss it, and eventually make one of these and start improving that aspect of your life.